Good morning to you all. Today we continue chapter 1, which is Introduction to Parasitology. The last thing we talked about last time was the life cycle, the general life cycle of the parasitology. And that life cycle which we talked about was the simple life cycle. Some parasites, they have complex life cycles. Today we continue with modes of parasite transmissions, how parasites invade us, or how do we get parasitic infections. There are modes of transmission, ways they enter inside us, portal of entry, or we call them sometimes chain of infection. First and the most common is ingestion of contaminated food. You eat food, you drink water, you drink juice, anything that gets inside your mouth. So it's oral fecal by ingestion or eating contaminated food, drinking contaminated water or fluid, regardless. And that's the first and the most common usually. First and the most common. Example of this, Entamoeba histolytica. In other words, all the intestinal parasites, the parasites that go inside the intestine, mainly they come through the mouth, per os. Then hand-to-mouth transfer. As I told you, some children, mainly in enterobiasis, Enterobius vermicularis, it's a nematode, which we will talk about later on in the course. Children, they have it on their fingers because they scratch their backs where the eggs are, and they put next day, they put their fingers in their mouths with eggs under their nails, and then they get infected. That's hand-to-mouth transfer. Contaminated fingers, eggs under the nails. Insect bite. Also, this is common. Malaria, leishmaniasis, trypanosomiasis. All of these, they come through insects. Malaria, without being bitten by Anopheles, the mosquito, you will never get the infection. Leishmaniasis, without being bitten by phlebotomys, sandfly, you will never get the infection. So, insect bite. Insect means it can be mosquito, it can be sandfly, it can be ticks, like babesia, ticks. Intravenous drilling through the skin. Some parasites, like schistosoma or schistosoma, hematobium, mansoni, japonicum, macongi, all of these, they can enter inside you through piercing in the skin, in your foot. So you are in water, in pond, and then they come to you and they pierce through your leg. If the water is up to your chest, they go and pierce here and here. Sometimes you don't see them. Yeah. And then they pierce inside and they go into your circulation and they cause the infection. Sheer example of this, schistosomiasis. Unprotected sexual relations. Not in our society, because our society, the sexual relations are very limited to the wife and husband. Other societies, everything is free there. And there comes the problem. Example of this, we call them STD, sexually transmitted diseases, or some people, they call them VDs, venereal diseases. And these here, sheer example, clear example of this, trichomoniasis. It's a flagellate that you find in men and women in the genital tract through STD. That's one of the most commonly or common parasites transported through this port, which is sexual relations, unprotected. Mouth-to-mouth contact. Some parasites, like for instance, Entamoeba gingivalis, and it has only one stage, which is the trophozoite, and this trophozoite usually it's in the mouth. How would you expect this to come to somebody else? Maybe by kissing, maybe hugging a child and kissing a child, or kissing a spouse. It can come. So mouth-to-mouth contact. So one has to be careful. Yes, if you study lots of things and your knowledge becomes very deep, then you suspect every move you do. Yeah, but if you don't, then you can do anything. The droplet contamination, droplet sneezing, and this droplet contamination, water, sneezing, splashing of water, mist, spraying of water. eye contact with infected swimming water. Some parasites, example of this is acanthamoeba. Acanthamoeba is an amoeba, but not in the intestine. It's an amoeba that attacks central nervous system, the brain. One of them is acanthamoeba. When you swim in the pond, and this pond contains the acanthamoeba, it goes through your eye and gets inside. Honestly, the most common of 1, 2, 3, 4, 5, 6, 7, 8 portals of entry or modes of transmission, the most common is the first one, food. And then comes maybe, and maybe they are classified according to frequency. These here, ingestion, hand to mouth, transfer, insect bite, many parasites through insects and like mosquitoes, flies, and ticks. Let's move to the next one. Who are the people that are likely to get parasitic infection more than others? Do everybody in our community have the same probability of getting parasitic infection? Certainly not. Some people, they are prone more than others. It may depend on what you work, where you are, maybe your sex, male or female, maybe your age, adult and children and old people, elderly. So let's start and see who is at risk. We call them population at risk. People who have the probability to get the infection, parasitic infection, more than others. First, individuals in underdeveloped areas and countries. And the developing world means they are poor countries. Example of poor countries in the world is sub-Saharan Africa. You know Africa? There is Egypt. You go to west, Libya. To the west, you get Algeria and Tunisia. And to the west, there is Morocco. Those are North Africa. Below these countries, we have the biggest Sahara in the world. It's called the Great Sahara. Below this Sahara, you have countries like Chad, maybe Sudan, Mali, Niger, Burkina Faso. All of these countries, they are sub-Saharan, below the Sahara. These countries are underprivileged. They are poor, and when you have poverty, you have uncleanliness, people are not clean, areas are not clean, then they get the infections, parasitic and bacterial and others. But here we're talking about parasitology. Refugees. What do I mean by refugees? Yes, people who take refuge. Palestinians took refuge in 1948. And one study in 1950 done by Dr. Tawfiq Kanaan in Al-Quds, in his study, can you imagine that those workers working at Augusta Victoria Hospital, the workers, they have 100% parasitic infections. Every person has a parasitic infection. So after refuge, what happens? Hygiene drops. Cleanliness becomes almost zero. And people become the victims of these circumstances. And they get parasitic infections. 100% of these refugee or immigrants, see immigrants here, 100% of these immigrants from the Flash Amora Jews who came from Ethiopia in 1985 to Israel, almost 100% parasitic infection, 100%, all of them. And some of them were lucky, not only one parasitic infection, two, double infection. So immigrants, people who migrate, and they don't have enough money to support good life. Refugees and immigrants. Visitors from foreign country. If you, as a normal human being, go to a country that is very poor, and then you have to eat there, and you have no other alternative except to eat from what they are eating, maybe you can get disease. Usually we call these sometimes, if it's bacterial, traveler's diarrhea. Okay, so this is the idea, is that you can visit a country, and if this country is a very poor country, there is a high probability that you will get infection because you have no other alternative except to eat from what they are eating and to sleep where they sleep. Individuals who are immunocompromised. All of us have good immune system, and this immune system shields us, protects us from all foreign bodies, from bacteria, from viruses, and from parasites. How about if you have very low and very weak immune system for one reason or another? You got AIDS, let's say you are under medication, some medication, they lower your immune system for whatever reason it can be, your immune system became weaker. What happens? The infections come to you easier. So immunocompromised patients, patients with weak immune system, they are more prone to, or they are at risk of getting parasitic infection and also bacterial infections and other infections. So immune system is very important. Individuals living in close quarters, prisons, where you have lots of people. In prison, jails, in one room, you might have 20 persons in one room. One of them has an infection, like enterobius. Just give it few months, that one will get the infection. So those closed areas with the crowded people inside, they're at risk. One is enough to spread it to all. Children who attend daycare centers, children at schools, children in kindergarten, they have the probability. And these children, very simple and very easy, they transmit the parasitic infection from one to the other. And one good example is enterobiasis, Enterobius vermicularis. If there is one child in the kindergarten, expect your child to become infected. Okay, so these are the population at risk. Again, the developing countries or underdeveloped, refugees, immigrants, foreign travelers or visitors, immunocompromised people with low or weak immune system, in prisons, in schools, in kindergartens, and anywhere where people are crowded. What are the symptoms of parasitology or parasitic infections? We have many symptoms, and these symptoms usually they are not very specific, to be honest. Let's say on top of the list is diarrhea. But is diarrhea something specific for parasites? No. Is it specific for entamoeba? No. I mean, bacterial diseases can give you diarrhea, can cause diarrhea. Parasitic, viral, but diarrhea is on top of the list, but it's not specific. You can tell only one thing: there is a problem. But what causes the problem? You need to test. Fever, the same thing. Almost all of them. Very few symptoms can help you point out the real cause that this is parasitic infection. Very few. Fever, when it's usually above 37. Chills, shivering, like in malaria, and fever in malaria. Diarrhea and amoebiasis, and giardiasis, for instance. Abdominal pain, many causes. Abdominal pain. Any parasitic infection, gastrointestinal, it can cause this, and bacteria. Abdominal cramping, pain that comes and goes, cramping. Elephantiasis, when your foot becomes like the foot of an elephant. Maybe this is something specific. It's only for filariasis, only for filarial nematodes. Example, Wisteria bancrofti, Bruguier. It's coming during the course. Anemia, hemoglobin level drops. Your hemoglobin level as a young man, instead of being 13, 14, 15, it goes down to 11 and 10. And as a lady, maybe below 10. Anemia. Vitamin D deficiency or vitamin deficiency, not vitamin D, vitamin deficiency, like vitamin B12. Bowel obstruction. The bowels, you know, the bowels, the intestines, sometimes they are obstructed. If you get an infection like ascaris, ascariasis, ascaris is a nematode, roundworm. It can reach up to 25 centimeters. And if you have a lot in your intestine, they obstruct your intestine, they block it. Your intestine becomes stuffed with it. So this is bowel obstruction. And not only that, sometimes there is an obstruction in the biliary duct and the liver, between the liver and the duodenum. Also, some flukes, they block that duct. So obstruction, when you have a lot of infection and the parasites are too many. Imagine if you have in your intestine 10, 20, 25 parasites that are as big as this pen, 25. They will obstruct and block your intestine. An operation has to be done and then taken out, maybe. Edema or edema. When you have a leg and there's lots of swelling. Enlargement of major organs. Some organs, when you have parasitic infection, they enlarge. Such as, for instance, the esophagus and the colon. In Chagas disease, there is what we call megacolon. The colon becomes very big, the large intestine. Yes, and others, enlargement of major organs. It's different from elephantiasis, the leg. These are internal organs inside. Or, give you another example, leishmaniasis. Leishmania, visceral leishmaniasis, caused by Leishmania donovani, or caused by Leishmania infantum. They cause the enlargement of the spleen, hepatosplenomegaly. Skin lesions, back to Leishmania. Leishmania, we have visceral inside, caused by infantum and donovani, and there is cutaneous, caused by Tropica, major, Ethiopica, and these cause skin lesions, ulcers on the lesion, very big, on your hands, on your face. We will talk about this during the course. Blindness, yes, you have parasites in Africa that cause blindness, and also we talk about these. So these are the symptoms. As I told you, many of the parasitic symptoms, many of them, let's say most of them, they are not specific. They tell you there is a problem, but you cannot tell, except from few. Testing parasites. The most common testing technique is the wet mount for intestinal parasites, stool and wet mount. And everybody is using this, and everybody is using it, and unfortunately abusing it. They just put the wet mount, the stool sample on a slide, and they just look for fusions, and then they tell you negative. This wet mount microscopy, it needs patience. You know what patience mean? Yes, it needs, at least you have to scan all the cover slip, which might take you 2-3 minutes. Most of the technicians, few seconds. Negative, and that's all. So first of all, wet mount using saline or iodine for intestinal parasites. We'll talk about this in the lab. Then we have direct fluorescent antibody. These are immunology and serology techniques. Yeah, enzyme immunoassay, like ELISA. Indirect fluorescence antibodies, IFA or IFT test or assay. For instance, the IFA or IFT, it's used in leishmaniasis, visceral leishmaniasis. Latex agglutination, a very quick test and has some false positive results. PCR, this is the new technology. This is the technologies that's making the difference. That's very quick technology, very sensitive. It can reach up to 100% sensitive and can reach up to 100% specific. And not only that, it can give you situation, genotyping. This is, for instance, let's say this is Entamoeba. Is it Entamoeba histolytica? Is it Entamoeba Dispar? Is it Intabiba Moshkovsky? These three, they look the same. Under the microscope, they look the same. You can never tell. And out of these three, only one of them is pathogenic, which is histolytic, and it's very rare. PCR and molecular methods in general, they are the future, and they are what we are doing now. And in advanced parasitology courses, it's all about parasites with molecular biology. Rapid immunochromatography techniques. These are techniques that are very quick, and they are also sensitive. PCR is for all parasites. That's no doubt about this. But here, some of them, they work for this parasite, and they don't work for the other parasite. Treatment. We have antiparasitic medications. Example, flagyl, metronidazole. Example, praziquantel. Another example for the worms, Verox. We have many parasitic effects. Not very, too many, but let's say 5 to 10. Okay. Change in diet. You have to change your diet for some parasites. Vitamin supplements. When you have hemoglobin going down and vitamin deficiencies due to some parasites, like there is a parasite, it's called Diphyllobothrium latum, fish tapeworm. It causes deficiency in vitamin B12. So if you have this infection, you have to be supplemented with vitamin B12. If you have anemia, you have to be supplemented with iron. Fluid replacement. If the disease is very severe, then it can cause dehydration. Then they have to give you fluid IV. Blood transfusion in some cases, and bed rest for all of them. So what's this? What's this? This is the classification of medically important protozoa, which we are going to talk about during the course. This is taxonomy. What is taxonomy? Yes. What's taxonomy again? This is taxonomy based on many things, maybe morphology, sometimes maybe on DNA, 16S ribosomal RNA. So this taxonomy is done not by me, by taxonomists. There are people who are specialized in this. And protozoa, which we are going to talk about, protozoa, there are hundreds of protozoa. In our course, we will deal only with those that are of medical importance to human being and to animals that are at the end related to us. So we have, at the beginning, we have the kingdom, and then we have the kingdom, which is parasites. Then we have protozoa. If you remember, we talked about protozoa, helminths, and arthropoda. These are subkingdom, not the kingdom, but subkingdom. The subkingdom goes down to phylum. Phyla, many, and phylum, one. Or these phyla. Number one is Sarcomastigophora, that's first. Ciliophora, second. And Blastocystida, third. And Apicomplexa, fourth. All the protozoa lie under one of these. Either Apicomplexa, either Blastocystida, either Ciliophora, either Sarcomastigophora. The Sarcomastigophora is branched into two types, Sarcodina and Mastigophora. Ciliophora, we have ciliates, a class, ciliate. And we are going to talk about only one, which is Bactridium coli. Blastocystida, we are not going to talk about it at all. Apicomplexa and Sarcomastigophora, we're going to talk about them in details. We start with this, Sarcomastigophora, Sarcodina, amoebas. So the amoebas, we are going to go into details in them, one by one. Mastigophora, Zoomastigophora, which is flagellates and hemoflagellates. Flagellates in the intestine and hemoflagellates in the blood. Flagellates in the intestine, like Giardia lamblia, we are going to talk about no less than 7 or 8. And the hemoflagellates, we will talk about two, Leishmania and Trypanosoma. These here, they will take a lot of time, but we will make sure that we go very fast so that we don't get behind. Then we go to the Celiophora, only one, Balantidium coli, only one. Then we go to the Apicomplexa. Apicomplexa, there is also, that's the protozoa. Yes, all of them are the protozoa. Apicomplexa, we have two branches, Sporozoa and Aconodacida. Aconodacida, we have two, Hemosporidia and Pyroplasmida. Hemosporidia, like malaria, we'll talk about malaria and its in details, the four types of the four species. Pyroplasmida, Babesia. Also, we'll talk about Babesia. The other one, Sporozoa, Microsporidia, we will not talk about it. But Coccidia, we'll talk about few of them. Isosporobilli, talk about Toxoplasma, we'll talk about Cryptosporidium. All of these are coccidians. So this taxonomy is very important for you to know where you are so that you don't get lost. This is the taxonomy. There is another classification which I personally made that depends on the site of infection. We'll talk about this next lecture. Any questions, ladies and gentlemen? No questions?